Hi, my name is Debbie Komisak. I'm doing this video presentation on background analysis, part 4 of my chosen project, which is teen eating disorders. My chosen project topic of teen eating disorders is important to my personal practice since I work in the area of pediatrics. Although PEDS is a broad range of ages and stages, the complex teenage years are sometimes the most challenging. Unfortunately, in this day of age of social media, photoshopping, teens are more than ever able to compare themselves to others. They are looking for acceptance, and at an age we're trying to identify who they are and how they compare. Also, eating disorders are complex illnesses which affects all age ranges, but the onset is usually in pre-adolescence or adolescence, 95% of them being between the ages of 12 and 25. There is a correlation of wanting the ideal body and eating disorders. However, there is no consensus as to what the root of the eating disorder is. It is thought to be a complexity of biological, behavioral, and social factors, unpleasant experiences, peer pressure, teasing, and also a family history of the disorder. Some teens are bullied and teased by their appearances, which leads to feelings of shame, and that can precipitate a eating disorder. With all the pressures on teens in this day of the world to excel at school, to excel at sports, to be involved in extracurricular activities, to be the prettiest, to be the most popular, an eating disorder can occur if one is susceptible to begin with. This is an important to myself and the nursing profession, especially for those who deal with children. Eating disorders of teens needs to be identified and treatment as soon as possible for a more favorable outcome. These disorders cannot be taken lightly, and educating the public and teens suffering from the disorders can help make the positive impact to the teens. Impacting my personal practice would include the area of helping the teen in the clinic I work in to have a safe place to come and discuss their eating disorders. I would be sure that no topic was off limits and make the session safe and develop a trusting atmosphere for the teens that would want to come in doing so, help make one step closer to recovery from their disorder. It would impact me personally because I have a personal understanding of being that teen with an eating disorder and having nowhere to turn but to hide it and feel different and misunderstood and scared. Having a safe haven for teens, which I would oversee, would help me provide education and compassion to those teens who are misunderstood and lost. An area of focus which this capstone project can impact overall profession of nursing would be first that the area of education, having designated areas in a clinic for nurses to educate or be as educators, be it on an eating disorder or any other area of health, can greatly impact the nursing profession. It can empower the nurse to take a specific area in their place of employment and create a place that patients can come to and feel safe and cared for and learn. Since my capstone focuses on teens with eating disorders, this would help nursing be more aware of the disorder and stigmas and also to help with the treatment, to allow teens to have a safe haven to discuss their disorder. Nurses of any specialty can follow and have a place in their own work environment to gather patients and provide educations to help empower the patient and make a difference in their life. This could range from, heart disease to diabetes education, just any kind of support group that you may want to have in your clinic, and educating the people and sharing facts with them, and also personal stories to help them in their recovery. Thank you.